In honor of International Day of the Midwife, Friends of Michigan Midwives and the Michigan Midwives Association bring you this series of 3 videos about Michigan licensed midwives. We hope they will help the viewer to understand the LM license and the CPM credential, and how this profession serves Michigan families who choose out-of-hospital birth. This is Part 2, History of the Licensed Midwife. Before we dig deep into the past, let's summarize where we are now. In early 2017, Public Act 417 of 2016 was signed into law, providing for licensing of certified professional midwives as licensed midwives. The Board of Midwifery was convened in mid-2017 and subsequently drafted rules for LM practice. The rules were promulgated in August 2019, at which time the first licenses were issued. This flew under the radar for many Michiganders, so let us give you some quick stats. As of May 1, 2021, 63 licensed midwives were listed under the Michigan Bureau of Professions. Many of these midwives attend births in clients' homes, the place of the majority of out-of-hospital births. In addition, there are 7 independent, that means non-hospital affiliated, birth centers operated by LMs around the state. One additional birth center featuring LMs and APRNs is currently providing prenatal care and plans to support births soon. Now, let's look at the history of the LM from the very beginning. Everywhere there have been people, there have been midwives, from the ancient world through the medieval age and forward to modern and contemporary eras. Even before the U.S. became the U.S., both indigenous and immigrant midwives were the primary birth attendants. In the North, this was the case until at least the mid-1800s. In the South, highly respected grand midwives provided most of the maternity care. These black midwives largely remained in the South during the Great Migration. Their practice was gradually restricted by state and local health departments. Nevertheless, they continued to serve their own communities as well as lower-income members of other communities until their practice was completely banned, and in some cases criminalized, by the 1970s. Michigan has a rich history of midwives in the 19th and early 20th centuries. Especially in the Upper Peninsula, a woman might take up midwifery to replace the income of a deceased spouse or to establish a lying-in hospital in conjunction with an existing boarding house. But then, the practice of midwifery was interrupted in the U.S. in a way that it was not in other countries. Here, newly consolidated medical practitioners forced out midwives in the competition for state recognition. In addition, many other factors, from the growth of hospitals to the establishment of Medicaid, led to the transfer of birth from home to hospital. Throughout this time, Michigan midwives continued to practice, especially in rural areas, but their days as primary maternity care providers were over. But the 1970s saw the emergence of a new type of midwife. Many factors contributed to this growth, including the convergence of the women's health movement, the Back to the Land trend, and religious organizations that were reconnecting birth with spiritual practices. In Michigan, these new midwives re-energized the profession. Some of Michigan's senior midwives today were early proponents of education and training standards that eventually became the Certified Professional Midwife Credential, the CPM, that is the basic requirement for a Michigan licensed midwife and for licensing in other states. The CPM is the only certification focused on training midwives in the out-of-hospital birth setting. This leads us to the licensure push in Michigan, which was led by Michigan midwives and their clients, the consumers. Then Representative Ed McBroom introduced licensure bills in 2011, 2013, and again in 2015 when HB 4598 progressed through the House Regulatory Reform and Senate Health Policy Committees. The bill passed both the House and Senate by overwhelming bipartisan majorities. The final vote was 81 yeas in the House and 36 yeas in the Senate. The governor signed the bill into law as Public Act 417 of 2016. The hero of CPM licensure in Michigan is, first and foremost, now Senator Ed McBroom. Others who played key roles were Representative Ray Frantz and Representative Scott Dianda, leaders of the House Regulatory Reform Committee, and Senator Mike Shirkey and Senator Curtis Hertel Jr., leaders of the Senate Health Policy Committee. Friends of Michigan Midwives and the Michigan Midwives Association are deeply grateful to these legislators for their promotion of licensed midwives. We also acknowledge the votes of other legislators who continue to serve in the legislature, as well as those who are no longer serving. Following the enactment of the licensure bill, the Board of Midwifery was established in 2017. Appointments were made of 7 CPMs, 1 obstetrician, 1 pediatrician, 1 certified nurse midwife, and 2 public members. A committee of the board drafted rules during the following year, taking into account the norms from licensing and regulatory affairs, best practices in rule drafting from other states, and input from various interested Michigan constituencies using notice and comment rulemaking procedures. The expectation for the number of license applications was exceeded almost immediately, and the licensed midwife workforce continues to grow. Further expansion is to be expected as new student midwives take advantage of the added stability of a licensed state by remaining in Michigan, and as Michigan attracts other new midwives from nearby unlicensed states. During this last year, Michigan licensed midwives have seen an exponential interest in their services as more families seek to avoid hospitals during the pandemic. Much of that interest has come from Medicaid recipients. In April 2020, advocates made a request to the executive branch for Medicaid reimbursement for licensed midwives on an emergency basis, but did not receive a response. LMs continue to operate at full capacity, just as Michigan families experienced increased vulnerability during the pandemic. Half of all births in Michigan are funded by Medicaid, yet even in the midst of a decades-long maternity care shortage and a newfound concern for excessive maternal mortality, Michigan Medicaid does not recognize licensed midwives or reimburse for their services. We hope that this part of LM practice, at least, will soon just be history. We hope you have found this history of Michigan licensed midwives informative. Please tune in for the final installment in our series, the Frequently Asked Questions video. Thanks for watching, and happy International Day of the Midwife.